Hi guys, welcome to my channel PKR Vibes Career and Growth. Today we will discuss about how to write an appeal to the insurance company on a denied claim. We will discuss now. So we have to know that in medical billing, if you submitted a claim to insurance company processed your claim and denied your claim. For example, insurance denied your claim stating authorization is required, but your doctor not obtained any authorization from the insurance company because the services doesn't require any authorization. So that's why doctor is not obtained any authorization from the payer, but your insurance is denied stating authorization is required. So for that case, if you are preparing an appeal, what kind of information you required, we will discuss now. So there is a specific appeal letter. For example, any insurance is there, for that particular insurance specific appeal letter will be there. Nothing but the information will be already written on a fax cover. You should have to document on a blank. Whenever patient name you should have to write it. Claim number blank will be there. You should have to enter your claim number there. That is a specific form. Sometimes some payers not having specific payer appeal forms. At the time you should have to prepare fax cover sheet to that particular pair. So nothing but general fax cover letter we should have to discuss now. If you are preparing appeal letter to the insurance company, what kind of information you should have to write on a appeal form, we will discuss now. First you should have to mention your date as shown in this PPT. First you should have to mention your date, on which date you are writing an appeal to the insurance company. Second point, you should have to write insurance name with complete address, city, state, code, zip code, and also the attention, at whose attention you are sending an appeal. For example, attention is a appeals and grievance department. If you are sending this appeal through the fax, you should have to enter fax and attention is a appeals department example. So if you are sending this claim through the PO box, at the same time you should have to mention your attention as a appeals department. Note one point, if you are doing appeal to the workers compensation claims, then you should have to mention attention as a bill review or bill department, not a claim department. So if you are doing appeal to the workers comp insurances, instead of a claim you should have to use the word bill, because workers comp insurances will not identify if you mention claim. Instead of claim you should have to mention bill wherever you are mentioning claim. And for example, you are doing fax cover to the commercial insurances, what kind of information we should have to document, we will discuss now. The requirement here, I given patient name, you should have to mention on which patient you are doing appeal, patient name, and patient's policy id, member id you should have to document on this fax cover. And date of service, on which date the service is given to the patient by the doctor, you should have to mention that date of service on the fax cover sheet. And charge amount of a claim, so charge amount is nothing but total billed amount on a claim. What is the total billed amount, you should have to enter in a dollar value. And you should have to document claim number on your fax cover, because you are doing appeal on a denied claim. Denied claim means already denial is there, claim number is there, so that you should have to mention your claim number on a fax cover sheet. And coming to the next point, you should have to mention like this: dear director of a claims, or otherwise dear madam or dear sir, you should have to mention this quotation. And also I given subject, four subject lines. First one is quote the specific reason for the denial stated in a denied UOB. For example, your claim is denied for authorization, but your doctor is not obtained any authorization from the payer because the doctor knows that no authorization is required whatever I am giving services to the patient. So at that time you should have to quote your specific reason like this: with the above claim information, claim is denied for authorization, but as per our doctor performed services, the authorization is not required, so that we are ready to prove the medical necessity. And coming to the second point in the subject, I given write supporting documents attached. So you're stating that okay, whatever our doctor given services to the patient doesn't require any authorization. How you can prove your medical necessity? By attaching the complete medical records. That medical records tells to the insurance that your doctor doesn't require any authorization. It should be proof, right? So medically necessity attachments are here nothing but medical records. So this medical records, whatever you attach it to the fax cover, telling to the insurance that your doctor is does not require authorization. So if you are writing that information, you should have to document like this: we have attached the medical records, we have attached the requested medical records, could you please review and reprocess the claim, or could you please review and process the claim accordingly. Then go to third point: write your contact details to get callbacks from the payer. So you are given reason and you are attached the medical records, then you should have to document your contact number. For example, if they need additional information from your side, nothing but from doctor side, then payer will give the callback you, right? So that's what you should have to mention your callback number on a fax cover. How to write, I will tell you. Write like this: in case if you need any additional requirements or any additional information from us, could you please feel free to contact us. So that you should have to mention your contact number, callback number. So that is the third point. Last point in a subject I given as a gratitude. For example, if you are doing appeal to the insurance, means it is a request, right? It is a request. How can you say that? Gratitude, show gratitude, like thank you for your prompt attention to this matter. So in that way you should have to give your gratitude to the insurance on a appeal letter. So last, sincerely you should have to mention, and your name. For example, your name is a Peter, you should have to mention Peter, and your last initial of your name is D as in Delta. For example, put D, capital D, Peter D, and mention your practice. For example, your practice is a radiology services, you should have to mention radiology services, and mention your complete practice address with the PO box, right? So and mention your fax number and callback number on a sample appeal letter I given here. So guys, this is the way how you are doing an appeal to the insurance company. For example, the claim is denied for payer deems experimental procedure. So for example, otherwise, take one more example. Claim is denied for non-covered charges, or CPT, procedure code, I mean procedure code, diagnosis code, whatever it is. If it is diagnosis code is invalid, you are sending claim to coding team. Coding team told that okay, whatever we coded is correct, so coded appropriately. So your next level is you are doing appeal to the payer. At the time here in subject you have to mention your reason like this: with attached to the claim above claim information, claim is denied for diagnosis code is invalid even though coding team is coded correctly. Next point: so we have attached the medical records, requested medical records. So could you please review and process the claim accordingly. In case, third point, in case if you have any additional information, could you please feel free to contact us, so that you have to provide your contact number. If possible, you should have to mention your extension. And last point, gratitude. Thank you for your prompt attention to this matter. So in that way, if claim is denied for so and so reason, you should have to elaborate your denied reason and attachments and your callback number and gratitude. This kind of subject is required. Guys, if you are watching my video first time, could you please subscribe my channel and hit the bell icon, so that you will get every video as a notifications to your mobile. And if content is useful, could you please like my video, so that it will reach us more needy people. And thank you so much for watching this video for last until this time. And have a nice day. Thank you.